Bismillah Rahman Rahim. My name is Dr. Fazal Wadood. I am working as Assistant Professor in Department of Theriogenology, Cholistan University of Veterinary and Animal Sciences, Bahawalpur. And the topic of my presentation is reproductive ultrasonography in animals. And as it is elaborated that human ear can hear sounds of 20 megahertz, 20 hertz to 20 kilohertz, and so ultrasound are high frequency sound waves that are more than 20,000 hertz, and when these waves are used to scan the objects, then it is called reproductive ultrasonography, especially of the reproductive organs. So first of all, we have to know about the ultrasound types. Uh, One type of ultrasound is sector scanning, and in sector scanner there are 2 to 4 crystals in the uh, transducer or the probe that scan the objects. And mostly frequency used in this is 3.5 megahertz. And second type of ultrasound is A or amplitude mode. It is one dimensional. It displays the one side of the object, and it has single crystal. And the third type is brightness mode or B mode. That is the most common used ultrasound in veterinary reproductive ultrasonography. It is two-dimensional, and location on display is related to depth and position of the object. And it is real-time B mode ultrasound, and you can see also the motion of the object. It have 30 to uh, 80 crystals that are made of lead zirconate titanate. And the fourth type of ultrasound is Doppler, and Doppler ultrasound scans the moving objects and give a colored image. And heart sound can be heard in this type of ultrasound. And ultrasound machines component uh, consist of a monitor that give the display, and the second part is transducer that scan the objects or the specific organs to whom you want to scan. And the machine have the control panel that have freeze, gain, range, menu, cancel, and fix buttons. And to whom by using these buttons you can operate the ultrasound. And there are various types of transducers which we will elaborate in coming slides. And commonly used frequencies in ultrasound are 2 to 12 megahertz. And it is worth mentioning that higher the frequency, the lesser will be the wavelength. And lesser wavelength means there will be less penetration of the wave in the body or the tissue. But higher the frequency, there will be high resolution, means there will be better quality of the image. Here you can see the monitor, the control panel of the ultrasound. So now we come to the ultrasound image construction principle. As the electricity crosses the transducer convert the electricity into sound waves, and sound waves are reflected by the tissue, and reflected sound waves are the echoes are converted to the signals that later are converted to the image. And how much the uh, intensity of the sound waves will be, it will depend upon the acoustic impedance, velocity, frequency, reflection and amplification of the sound waves. So now we learn about the probe types. Uh, that could be linear uh, probe. Uh, it could also be classified as the straight linear probe. In this image is transrectal form. In this type of probe, this is used transrectally, and image in this is rectangle. So its interpretation is easy, and it is less costly, being long life. And these type of transducers have 64 to 226 crystals. And the second type of the transducer or the probe is trans-abdominal or transcutaneous. And the image in this probe is convex. Here you can see the different types of probes. This is the linear probe, and that is used transrectally in animals, and this is the convex or transcutaneous probe that is used on the skin. And as you can see, image in the transrectal linear probe is rectangle, and while the image in transcutaneous or transabdominal probe is uh, it is convex in shape. So now we come to the benefits or the advantages of the ultrasonography, reproductive, especially reproductive ultrasonography. It is non-invasive. There is no surgery involved in it. It is non-toxic, have no radiation hazards, need not general anesthesia or sedation. It facilitates instant and real-time dynamic image. You can see the live images of the objects. It is mostly inexpensive as compared to other techniques, and you can see the location of the biopsy needle in this. And what are the applications? You can diagnose pregnancy through ultrasonography, and you can see fetal viability 20 days uh, after 24 days of after insemination by detecting the heartbeat of the embryo. You can see the fetus near about 40 days of pregnancy. You can perform fetal sexing by scanning the genital tubercle at day 49 to 52 of gestation. And linear probe uh, can perform uh, fetal sexing up till 3 to 4 months of pregnancy. If the fetus is the male, then the genital tubercle will be in hind limbs, and in between the hind limbs and umbilicus. While if the fetus is female, the genital tubercle can be located uh, uh, between hind limbs and the tail. You can also use ultrasound uh, for follicle synthesis, for ovum pickup in vitro fertilization and ovarian cyst. You can also use or apply the ultrasound in estrus and ovulation detection, and you can also detect follicle and CL, that indicates corpus luteum, and you can perform their measurement. Yeah, we can also detect inflammation of the endometrium, that is called endometritis, You can see the mucus in the reproductive tract called mucometra, excessive accumulation of the mucus in the reproductive tract. You can also detect the pus called pyometra in the reproductive tract. You can see the fetal mummification in which image is highly hyperechoic or the very bright in color in display. You can see the fetal bones and mummified fetus that in which the fluids have absorbed. Uh, we can detect uterine cysts, fibroids in reproductive organs. Follicle, we can perform follicular and luteal cyst differentiation. We can detect tumors in the reproductive tract and can perform fetal growth assessment and gestational age of the fetus by detecting chronograph length, that is length between the top of the head up to the back from the point where the tail originate. Bipartite diameter, that is the widest part diameter of the head, thorax diameter and head length can be used for gestational age assessment of the fetus. We can detect the fetal numbers and also detect the abnormal pregnancies. Embryonic loss detection can also be performed through ultrasonography. We can assess the uterine involution status and the air in the uterus. Uh, we can also use ultrasound in twinning in case of equines, that is very worthful, and we can scan the genitalia and can detect their pathological conditions. We can detect an ovulation when the follicle not ovulate or egg is not released. We can detect the follicular cyst and other type of cyst in the reproductive organs. Testicular lesions, testicular size, tumors, cyst, sperm granuloma, that is accumulation of sperms in the testes, spermatocele, and hematoma, uh, and the prostate cyst can be diagnosed. We can also observe hemodynamics or movement of the blood through Doppler ultrasound. We can detect heart sound and can get the colored image by Doppler ultrasound. How to Now we come to the point how to get the best image. What is the technique? For this, we should know about equipment. It's called control panel, brightness, contrast, grayscale adjustment, and ultrasonography technique. We should also aware about the knowledge of anatomy of the area. We also for better ultrasound, we should be aware about the landmark identification, which is the point to start the ultrasound. Uh, Certain artifacts also arise during ultrasonography and they can mislead the sonographer. So artifact knowledge is also required. And different types of artifacts are also described here. You can also store the images and in the ultrasound and can examine on later stages. And in the technique, important points is also safety of the operator, machine, and patient. Ultrasound should be performed with full bladder that enhance visualization of the uterus, and the animal should be properly restrained. Screen of the ultrasound should be at eye level, and external light should be minimum in the room. Evacuate rectum of the animal when you perform transrectal ultrasonography, and always lubricate the transducer to remove the air between the transducer and the object. And for better ultrasonography, firmly press the transducer against the skin or mucosa. When you scan the vagina, cervix, uterus through rectal ultrasound, see first on longitudinal axis, then you can perform the uh, uterine harms ultrasonography on cross section or oblique view. B mode is mostly used in veterinary ultrasonography, and movement of the organs help in identification and perform proper ultrasonography. You can also measure the structures as the machines mostly have built-in softwares. Before start of ultrasonography, remove the hairs, and in large animal, ultrasonography is preferred in standing position, while in small animals, as small ruminant sheep, goat, dogs, and cats, dorsal recumbency is preferred. And 7.5 megahertz is the frequency in linear probes or transector probes, and 5 uh, megahertz frequency is used mostly after 40 days of pregnancy, and 3.5 megahertz is used in late pregnancy diagnosis, and the probes used are transcutaneous in late pregnancy. Sexing and gestational age of the fetus is performed by linear probe as the transrectal probe. Here you can see the image interpretations, elaborations. Uh, Echogenicity or the brightness. Uh, Echogenicity display shows the brightness of the image according related to the surrounding tissues. As you can see, it is anechoic image, means the tissue to whom you scan, if it is fluid filled, then it will generate darker image as compared to the surrounding tissues. It is hypoechoic, means tissue have some what more matter and have more density, so the image is somewhat brighter as compared to the surrounding tissue. And hyperechoic image, when you scan the highly dense tissues as bones, mineral calcified, and structures, you will find the hyperechoic or the more brighter image compared to the surrounding organs. Yeah. And you can in early pregnancy diagnosis, you can detect the pregnancy at day 17 to 19 by scanning the CL, carpal luteum, and you can you can see the little anechoic lumen in ipsilateral horn, means there will be some fluid accumulation in the ipsilator, all the horn that horn that have the pregnancy, and CL is on the same side of the ovary. So you on day 22 to 24, you can see that embryo have starting its heartbeat, and out you can on day 30, um, you can see the membranes, you can see the anechoic lumen is increased, and on day 35 you can see the uterine crunkles, that are the structures present in large and small ruminants. You can see the crown ramp length and BPD. What type of probe you use in different animals and at different stages of pregnancy? In cattle, buffalo, mare, camel, as they are large animal, you use the linear transrectal probe, and that is mostly 5 to 10 megahertz in frequency. In sheep and goat, up to 40 days, you use the linear probe, that is 5 to 10 megahertz, and onward from day 40 you use the convex probe, that is 3.5 to 5 megahertz. And in the SO A mode or sector scanner and linear probe, that is 3.5 to 10 megahertz are used. In which, as they come in the small animal categories, in early stages you use the linear probe that are 5 to 10 megahertz in frequency, and late pregnancy you use the convex or transcutaneous probes that are 3.5 to 5 megahertz in frequency. Here you can see what uh, structures you can observe post mating in different animals at different stages of gestation. As we can see in cow, fetal fluid come at day 18 to 20, and you can see fetal heartbeat in at day 24. You can see the cotyledons at day 35 to 40. Fetal bones uh, you can observe at day 60 almost, and fetal sex determination can be performed around 60 days, and fetal movements can come at day 50 almost. So similarly you can see the changes in other animals. Now we come to the male ultrasonography. In these points that are to be evaluated, it is texture of the testes. You can observe cyst, hematomas, tumors, and if you want to scan the epididymis, it is almost anechoic, as it have the sperms in it, and you can see the anechoic image. And you can in male ultrasonography you can perform prostatitis, or you can observe the inflammation of the prostate gland, and you can also observe the tumors of the prostate gland. And thank you very much to everyone.